I'm Lara, the author of Your Bones, and I'm here today to share some information with you that I hope will help you to have healthier bones. In our last video clip, we talked about how much calcium you should take at one time to get the best absorption from a calcium supplement. And that amount turned out in the research to be 350 milligrams per dose, okay, and then about 720 or so per day. But you want to break that amount up into about 350 milligrams per dose. And in the research that showed that this was beneficial, it showed that you were absorbing about 36% of the elemental calcium when you took a 350 milligram dose. And so I asked you to consider what was happening to the rest of that calcium, the 64% of calcium that then passed out through the digestive tract, and whether it served you, whether it did anything for you. And in this video, I'd like to explain to you some of the benefits that unabsorbed elemental calcium provides for your body. Calcium remaining in food residue or from supplements that you take actually combines in your intestines with harmful substances that are left over from digestion, such as oxalic acid or unabsorbed fatty acids and bile acids. And this is the mechanism through which high calcium diets actually reduce our risk of kidney stones and cancer, because that calcium combines with potentially harmful substances and puts it in stool so that it is evacuated from your body. There's a bunch of recent studies that confirm some of these benefits, and I'd like to share with you some information about two of them, one about cancer and one about kidney stones. So the first one I'd like to talk with you about was published in 2014, and they looked at 41,403 participants in the Nurses' Health Study who ranged in age from 20 to 60 years. And what they found was that women who had low intakes of calcium, less than 500 milligrams per day, or even as much as only 700 milligrams per day, had a much greater risk of multiple and advanced colorectal adenomas, in other words, colon cancers. I'm going to post the references along with this video on AlgaeCal's website, so if you're interested in this research, you'll be able to go on PubMed and find this study. The other study I'd like to talk with you about was one where they looked at kidney stone formation and whether calcium consumption was beneficial for preventing kidney stone recurrence. And that is what they found. They did a Cochrane review, which is the gold standard of reviews for the medical literature. And they looked, and it was published in February of last year, 2014, and they looked at people with what is termed idiopathic hypocalciuria, which simply means that they were forming kidney stones and the researchers and their doctors didn't know why. So they found 5 studies that looked at people with this problem, and every single one of those studies showed a significant decrease in the numbers of new stone formation in those people who were treated with calcium, normal calcium intake. So optimal is 12 to 1500 milligrams per day of calcium, and a low protein, a low salt diet. They showed up to a 28% decrease in new stone formation with good calcium intake. So if all the calcium that we consumed was absorbed from the intestines, we would meet our body's skeletal needs for calcium, but we would not provide for this very important detoxification function that unabsorbed calcium serves within the intestinal lumen itself. So unabsorbed calcium is going to help you prevent kidney stone formation and colorectal cancer. To sum up from the last couple of videos, you want to get the best bang from your calcium supplement buck. You want to take your calcium with a little food. Even a small snack will cause your stomach to produce hydrochloric acid that is required for the optimal absorption of any form of calcium that you're taking. Then you want to take your calcium in a dose of about 350 milligrams twice a day. And you want to ensure that your blood levels of vitamin D are in the optimal range of 50 to 80 nanograms per ml. I'd like to talk with you next time about calcium-fortified beverages and whether these are a good source of supplemental calcium and can be relied upon to help you meet your calcium needs. Thanks for tuning in.